Now we're going to pass it on to Barry Isaacs and Yona Linsky, who are going to tell us about the Sector Pandemic Planning Initiative.
Thank you. So I'll start. I'm Yona, and I'm at the Center for Addiction and Mental Health in Toronto, and I lead a research program called HCARD, which focuses on healthcare for people with developmental disabilities. And the sector we're talking about is the sector that supports people with developmental disabilities. So I just want to briefly say a few words about the population, and then Barry will talk more about the initiative and the project. This group of people with developmental disabilities is actually a really heterogeneous group of people with lots of different kinds of issues, and they cross over in terms of feeling marginalized with all of the groups we've already heard from. Some of those individuals require extensive day-to-day support, and they might be living in a congregate care kind of group home-like setting. Some of those people are living on their own or are homeless or with families. So it really kind of depends, but they all rely on social services. Most of them are not employed, and they're really needing services for their day-to-day to give them meaning and to keep them safe. And we know that this group is, in terms of COVID, both at greater risk of getting it, but also because of a number of health issues they may already have, at greater risk of being quite ill and dying if they do get COVID, from research in other countries. We don't have data because we haven't really counted or looked at what's going on for people with developmental disabilities here. So it's a complex group, and the way they get their services in Toronto is through a number of different agencies, through social services. I think that's a good segue for Barry to talk more about the initiative.
Sure, thanks, Yona. So the Sector Pandemic Planning Initiative is something that came out of something called the Toronto Developmental Services Alliance, which is really a group of agencies that provide services to people with developmental disabilities and their families in Toronto. There's 30 plus, I'm at 30 something, I'm not sure how many of those agencies, and the SPPI really is that group, or a large section of that group, working together to formulate a system level response really to supporting people with developmental disabilities and families and whatnot during the pandemic, and really helping agencies do their work. So we know that the impact of the pandemic has been pretty big on people with disabilities, for sure. I mean, as Yona said, they have often a daily reliance on services, and these services have been disrupted. Sorry, I think you can hear my dog barking. These services have been disrupted greatly. So many people are having trouble accessing services. There's a lot of reports of increased social isolation, mental health difficulties, behavioral difficulties. The agencies themselves have been impacted as well. Really, there have been a lot of unsafe working conditions, inability really to carry out the services, the duties that they once did. So the SPPI is really formed as a system level kind of response to some of these or to these issues. So it really is focused on helping agencies or supporting agencies so that they can then do their work to support individuals with disabilities and their families. I won't go into really the structure, I guess, of the SPPI, just to say that over the few months of the pandemic now, it has really had quite a tremendous output of things like policies, guidelines, tools, whatnot, dealing in areas like human resources, safety, ethical, legal considerations, guidelines around things like essential visitors, reopening, all kinds of things. There was a 2 needs assessments done, one for staff, one for families. So there's been a lot of output, and this has been not only helpful, I think, within the Toronto developmental services sector, but also to the province, as a lot of this stuff is pushed up to the provincial level as well. In terms of what we're going to do, we're not really quite sure with the evaluation yet. I mean, I think, like I heard in a previous presentation, that we really need to put together the logic model and then work with the SPPI to figure out what the evaluation questions are going to be, what the focus. But I mean, there's lots of questions around process. How does this all work? What enables it? What are the facilitators? What are the barriers? And then, of course, what have the benefits have been? And I just want to say that Don Walker and Martha McGrath from the SPPI are here. So Don and Martha, if I've missed anything, misrepresented anything about the SPPI or anything you want to add, please go ahead.
Thanks, Barry. Hello, everybody. Great research projects coming out. It's exciting to hear some of that information. From our perspective, a couple of things I would add, Barry. One is in respect to the SPPI and the whole IPAC component, which is another segment that we're working on with local hospitals as well to support agencies. And Barry was right around the numbers of agencies that are involved, and it's expanding and using some of our guidance provincially as a resource for people. When you mentioned earlier about some unsafe working conditions, needless to say, that's an area that we focus on very quickly and address with supports from local hospitals, public health, and to the best of my knowledge, although we still on occasion may have an unfortunate COVID positive, we have not had situations where sites have been declared unsafe for working conditions. So I just wanted to add that component as well. Martha, was there anything that you wanted to add?
I think you're muted, Martha.
I'm sure maybe many people on the call might share this feeling that at the beginning of the pandemic, it felt as if provincial leaders were not as aware of, say, for example, our sector. And so all their planning was, say, focused on the more high profile needs like long-term care. So it was great that we had this sector alliance so that we could help each other until the ministry leaders knew our challenges. So say they later on realized congregate care, like group homes, were just as vulnerable from massive outbreaks as a long-term care hospital. So we got that attention later, but it was so good that we created this type of an alliance that we could advocate for each other and create our own solutions working together.
Thanks, Don and Martha. And I'll just add that, if anybody is welcome to join the team, I think we have about 5 or 6 members at present. I'm sure I haven't counted, but anybody is welcome. Thanks.